Thank you, Marilee. I'd like to thank the organisers for giving us time to talk about BloodMove. It's something that's quite close to Marilee and my heart. So cold chain security, I've sort of split that into three parts. First part is the storage. The storage of blood is very important. The specific fridges designed for the storage. They're not cheap. They vary from about $9,000 to $13,000 each, but they're extremely well-made precision bits of equipment. And there's an Australian standard that specifies, one, how these fridges are made. Of late, point 1 has come out and it's designed specifically for manufacturers. Point 2 is if someone owns a blood fridge, how you are to maintain it and oversee it. So there's a specific standard for the oversight of blood fridges. AS 3864, we know quite well. What's important, what we've come across with these fridges is that the SA government has allowed vaccines to be stored within these fridges because they far exceed vaccine fridge requirements. And I believe the new Strive for 5 will have a clause that says blood fridges can be used to store vaccines, and whatever blood fridge monitoring is being performed, it is the only monitoring that's required. So it's basically a very handy bit of extra ability of the blood fridge because it saves these sites needing to maintain 2 fridges. In the past, there were hand-me-down fridges from metropolitan hospitals that were given to the country sites because they were basically better than nothing. These fridges were good, but were sort of borderline compliant. And safety issues from the top view of these fridges were far from adequate. So they'll definitely fail any sort of electrical inspections. That's part 1, it's the storage. Part 2 is the documentation or the assurance documentation. As we know, we basically document everything. The more you go up the food chain, when you get to the TGA level, everything's basically documented. Fortunately, TGA blood fridges need to be on the ART, don't need to be on the ARTG. They can be voluntarily entered on the ARTG. But if you use a blood fridge, you need to use it according to the standard. The consignment, there's various parts of the documentation, the assurance documentation. One is the consignment record. This is the paperwork that the lab sends accompanying the unit or the units of blood. Where it pointed doesn't sort of show. This document is a part that the laboratory completes. It's basically a checklist that the lab completes by what means, by what configuration the blood was packed, for whom it was for, the time it was packed. And then there's a section that the receiver completes. And the receiver will indicate that, yes, the blood was received in temperature. And this sheet is sent back to the laboratory. The laboratory there has confirmation that the blood was sent, arrived, and was within temperature. So that's one leg of the trip has been confirmed. The next leg is the confirmation of the storage of the blood in the refrigerator. This is a standard sheet that is available online, I believe from our BloodSafe site, but also the Blood Service has it on their site. It's for sites that do not have electronic computer monitoring of their fridges. In this case, the standards allow for daily monitoring, so you do daily manual recordings of the blood fridge temperature, in addition to the circular chart, the thermographs that are continuously recording, those charts providing objective evidence that what the temperature is. We've also got space in this form, just trust me what it says, is these are sections where you actually do the temperature alarm or the alarm challenges, be it power off alarm challenge or a temperature challenge, just to make sure that the alarm systems are all working. And these are currently being done weekly. In the future, this form is going to be updated to reflect the new standards, which do not require weekly challenges testing. So just watch this space for the new form. So it allows for any occurrences and deviations to be documented. There's a section where it's signed off, and this document is actually sent back, a copy of it sent back with any returning units, thereby providing evidence to the laboratory that it was stored correctly. But labs, being somewhat, meticulous with certain things, want further evidence. And this evidence here comes in the red cell return form. And this red cell return form is signed off by the person, be it the nurse, sending the units back. They put the details of the unit number, any occurrences with that unit number, so that they document the units that are being returned. And again, checklist sign off items that, yes, it's been stored correctly, it hasn't been taken out of the fridge for longer than 30 minutes, all the charts are compliant, and everything's been checked. And again, they sign off and date that. So it's not really a stat deck, but it's basically a storage confirmation sheet. And that's sent with the returning units. The lab has got a checklist as well that they go through, and with that, once it's fully complies, then the lab is happy that those units can be reintroduced into their inventory and possibly used for another patient. So that's documentation. Now we go to shippers. Normally I talk a lot about shippers. Other talks I've had about 10, 15 slides on shippers, but I've indicated I only had one slide for shippers. I've actually got two. One data slide. So the shippers comes into the responsibility of the laboratory. The laboratory who gets the MBS item number in the rebate for providing the pathology service needs to be able to send the blood to the receiving site. So the lab must use blood shippers that have been validated for common and uncommon dispatch routes. In the main, blood service shippers are used, and these need to be validated if there's any variations to the stated blood service times. The supplying lab must provide shipper packing procedure and the returning courier system to the hospital. So it's got to make everything easy to the hospital to be able to return the blood. So we've got packing instructions. We actually got pre-printed courier consignment notes. So there's those consignment notes are only used for the return process. Then obviously the hospital must use this packing procedure and the courier system when returning blood. So this is part of education that we go through every time we visit a site. So blood shipper validation. As we know, we have many challenges in Australia, and I'm sure there's other bigger challenges in other parts of the world. But basically, you need to know your consignment pathways, know your possible temperature excursions, and you've got to make your shipment system robust. So robust that for any subtle variations that occur operationally in the field, need to be able to, the system be able to deal with that. So I had lots and lots of data slides of the scores of validation experiments I've performed on the blood service shippers. But I want to show one data that I got from a colleague from Townsville. He used to work here in South Australia, but he knows a lot about shipper validation, and he basically did the basically blood service shipper system, which used to be called A, now it's called R1, with 4 units of blood in the back of a car in the Townsville car park. It got to 52 degrees in that car. This is 24-hour cycles here. So obviously daytime is a lot warmer than it is at nighttime. These are, I think, the increments at the bottom are 12-hour blocks here. So it's 24, basically, 2.5 days worth of exposure to this shipper. And the blood stayed within temperature for 42 hours. So it's a very robust shipper. I'm very happy with it. So you really need to know your temperature pathways. This is inside the toll courier, so the toll depot at the airport. It's a massive depot. Probably about 50 semi-trailers can fit inside this depot. It's massive. I've put in a logger. That's a box with a logger. So I'm recording the temperature inside the toll depot to supplement the data that we get from the Bureau of Meteorology. Because I've got data from outside in the airport, I've got data from Mount Crawford, data from Kent Town, but you want to get data where does the shipper live? Where does the shipper stay overnight when it's being sent to its destination? So you really need to know your destinations. And what applies to South Australia might apply differently to ACT in winter or alpine winter conditions. So you really got to formulate a system. And this is a picture, we've got this laminated, this system packing instruction goes to all our country sites. It is basically the R1's blood service configuration. And we know this can last quite well beyond 24 hours. But 24 hours is the time that I'm sort of sticking with. Audits, we perform audits, both BloodMove and BloodSafe audits are done in all the hospitals. We audit the blood fridge records, the blood registers, and BloodSafe does audits of the blood administration records. So this is not necessarily done by the leads, this is done by that network that Marilee was alluded to. We need to have an incident reporting system. So SA Health is fortunate enough to have a SLS system, which refers to Safety and Learning System. So basically, if you don't know if something's happened, you'll make that same mistake again. The laboratory system's got a similar system called QPulse, and OFIs are generated. OFIs being OFIs, opportunities for improvement. The system basically reports anything that occurs because of a laboratory issue. This graphic, basically, the person loaded with information can achieve advancement, where the people that haven't got information cannot. So the important is you need to share your errors and don't be shy to tell others about the errors that have occurred. And that's the only way that we can improve, is by corrective action. Communication is important between the team, the hospitals, the laboratories, and the transfusion committee. This network that Marilee mentioned, it allows the stakeholders to tap into and get advice. So the channels that were present before between the labs and hospitals are nurtured and enhanced. Obviously, the site visits provide guidance, training, and support. Marilee meets with the clinical nurses by teleconference often, and us as leads, we provide guidance and problem solving between the hospitals and laboratories. So we act as conduits. Sometimes Marilee deals with the clinical issues and where I deal with the laboratory issues. So it's a unique team, and I believe it works well. So what's the future? Basically, we're always assessing new systems and processes to minimise blood wastage and cold chain security and better inventory practices. This might be wireless recording of blood fridges or targeted use of loggers or better shippers. We want to raise the bar to ourselves by lowering the target wastage KPI. In the past, country was 6.4, now it's been reduced. City, we were reducing our targets. Just so, once you get to the comfort level, you want to challenge yourself again and lower the bar and see how good you can get. BloodMove assistance has been offered. It was actually offered 12 months ago to the private sector, and all of the private sector in Adelaide has embraced it. I've BloodMove visited every private hospital in South Australia, or in metropolitan South Australia, bar one, and they've all quite happy to be involved because they know it assists with their standard 7. The private laboratories are all come on board as well, so which is great. And already assistance is, the private laboratories assist with, using their couriers to bring back public cross-matched blood from the private hospitals. Just by doing that, we've saved $100,000, just by that simple move. Also, BloodMove is assisting with hub-to-hub inventory management between the public, metropolitan, and private transfusion services, and this is realising significant savings. So, the seeds that were sown some time ago are going to blossom and grow into very fruitful trees, we hope, in the future. But what I'm really excited about is not the nuts and bolts and paperwork and equipment and shippers that we've been dealing with, but what we're really excited about is the cultural change, what we've achieved. So now staff are mindful of wastage and they do their utmost to avoid it. Staff embraced ownership of the units. The concept of being a steward. So it is something that now people, if they see that there's wastage, potential wastage, they'll do whatever they can. So it's basically accepted practice throughout Country Health SA and the laboratories. So what was previously thought as unavoidable wastage is now seen as avoidable. There's resources available at the SA BloodSafe site, and as Lee mentioned, on the case study site in the MBA. Thank you. So, a blood cell. Look after me, I'm special, I'm a volunteer.